And welcome and thank you for your time. So the purpose of this meeting really is just for us to fundamentally get to a question and answer session around any thoughts, comments, issues you have around our current response to the COVID pandemic. After my very brief introduction, Paula Hull, our Chief Nurse, will give an overview of the current national and local position. We'll then have a brief update on the vaccination programme from either our Julia Lake, who's Deputy Director Nursing, and our Chief Pharmacist, Raj. So that's what we'll do, and then Paul Draycott will chair a question and answer session. So a relatively informal meeting. We are recording it so that other colleagues who can't be here today might join it and pick up on anything that's useful. So over to Paula, really, and over to you, Paula.
Thank you. Welcome, everybody. A lot of this I'm sure you are going to know, because I'm sure you all watch the news, and we're getting quite a lot of information every day, aren't we, about what's happening. But cases across England are starting to slightly fall in terms of people in our community that have COVID-19. This is reduced by 22.2% in the last 7 days. So that's really good news for us. And usually what we find is when we start to see the population figures going down, that has an impact, usually 2 weeks, sometimes a little more than 2 weeks later, on the admissions into hospital. So it's a key piece of data that we're watching. You can see in England, the cases per 100,000 are at 504.5, which is down from 632.8. So again, going in the right direction, although we aren't being complacent about that, because in the southeast of England in particular, we have had some particularly high numbers in the past. So we're still being quite careful about that. The death rate, however, and the number of patients admitted to hospital is still on the rise, and will continue to do so even when the community population numbers plateau. We will still have a period where that will happen. And over 4 million people so far have received their first vaccination, which is also really great news. Cases in Southampton seem to be going slightly down, and in most parts of Hampshire, but Portsmouth is still a hotspot area for us, although numbers in Portsmouth University Hospital of COVID patients is actually decreasing. So that is good news. Currently today, we've got 70 COVID positive patients in our inpatient units. 9 of those are in mental health, and 61 of those are in physical health. And we have 140 staff self-isolating and 50 staff that are off sick. And that's obviously on top of the normal sickness that we have in our team. So we are seeing an increased pressure around our staffing, in particular in some of our units. And we're doing a lot of work to ensure that we're getting as many staff to support in those areas where staffing is really challenged at the moment due to self-isolation and sickness. We're seeing rising numbers of patients with COVID-19 and staff that are self-isolating. So it's really important for us to just re-emphasize our infection prevention precautions that you all are very familiar with, around hand washing and thorough hand washing, your mask to help protect, and your social distancing are the 3 really important measures that we're asking everybody to be really vigilant about all the time, particularly with the new strain of COVID-19 at the moment, which is particularly transmissible to all of us. We're also just reminding you that obviously the lockdown rules are, it's been a long time now. It's very difficult for a lot of us with our friends and family. It's difficult because we feel isolated, and some of the things that we love to do and that we normally do, we can't, but really hoping that our NHS team help to role model the behaviours for the rest the population that we really want to help to keep us all safe. And I know you're doing that. So thank you all very much for the massive efforts that you're taking every day to keep each other and your patients and families safe. Thank you. Is Julia with us?
She was due to be. I can't see her.
Okay. Shall we continue? Or Raj, happy to continue?
Hello.
Hi, Raj.
Hi. Should I potentially give this feedback unless Louise is on the call? I think Louise Jones. If you're on the call, otherwise I'll give the feedback. So, as we're probably aware, the Oakley Road vaccination hub is up and running. It's been in place for nearly a month now, I think. We've been quite fortunate in the sense that we've already vaccinated 3,000 staff. It's been, I don't know, for those of you that have been down there, it's an amazing operation, very slick. It's open now 7 days a week, 12 hours, and I would really encourage everyone to get onto the booking site if you haven't done so already to go ahead and book your places. I know there's been some challenges with that. I think it is something that we're working through, but from last time that I've seen and been briefed, it's fully available. One of the key things which has come out is about cancellations, and obviously the appointments are quite limited, so we would ask that you give us 24 hours for cancellation notice, just so that we can open it up and offer it to someone else. The key thing also to remember is you need to bring an ID and preferably your NHS number, so that we can feed that back into the national system and make sure that we have a comprehensive list of everyone that's been vaccinated. We also have a short notice attendance register, which is on the intranet, and that allows us again to open up appointments last minute and offer those to individuals that haven't yet been vaccinated but are available relatively short notice. So there are, obviously, you've probably seen in the news and from your clinical areas that there's particular groups of individuals that are higher risk if they develop COVID-19. Those are obviously the clinically vulnerable or clinically extremely vulnerable groups. The BME staffed, those that have been identified within their risk assessments as being at high risk of developing COVID complications. Those working frontline and in inpatient environments, those are obviously both clinical and non-clinical staff. Community staff working with clinically extremely vulnerable patients, and obviously community staff. As I've mentioned, also the Medi-Rest staff, such as domestics that are working within the frontline environment, and also encouraged to come in and get vaccinated along with NHSP staff. So we've also been really fortunate in being able to secure some additional slots within HHFT in the north and Winchester. Those will be coming online in February. If you're interested in booking into one of those slots, please talk to your line manager. Some staff have already been able to secure vaccinations through the PCNs. Obviously, we all know that vaccinations are of limited supply. And therefore the system's been asked to redirect any vaccinations which might have a short life to anyone else that's applicable within the priority groups. Again, please could you send your details to the divisional coordinator so they can record that you've had the vaccine. People that have allergies will be offered the vaccine at one of the hubs, unless they have a severe allergy, in which case we're taking the precaution and advising that they go to one of the hospital sites. We've got a specific pathway for that. So if you email the vaccination team with your details, they'll be able to sort out a slot within one of the acute trusts. Again, there's a bit of information about second vaccinations. We were advised from NHS England that the position had changed, and rather than offer the second vaccine 4 weeks apart, this is now being extended to 12 weeks. The rationale behind this is obviously we're trying to vaccinate as many people as possible, and essentially we're able to vaccinate twice as many people if we offer it with the extended period. The data shows that actually the short-term efficacy of the vaccine is around 90%. So we're only losing around 5%. And also, more importantly, the data also suggests that we're reducing the risk of developing severe COVID as well. As I mentioned, the JCVI modelling demonstrates that actually vaccinating twice as many people overall will have a greater impact on society as a whole in reducing this illness across our communities. You'll be invited to book for your second dose within this time scale. I think that's part of the process that we have in place. And obviously, the vaccine itself won't limit the spread of the virus completely. It's really important that everyone continues to follow the infection control measures, which Paula talked about at the beginning of this presentation. Over to you, Paul.
Paul, are you there? You on mute? Are you still there, Paul?
Sorry, I think Paul might have some technical problems. So until he joins us, maybe if I could start the question and answer session, if that's okay. So there's some questions people have been answering in this sidebar. But just to kick us off, there's a question around the pressure on mental health services and investment. Just taking me back up to that, that was from Jeremy and the CMHT. So really the question is, alongside the investments in, I guess, a range of hospitals and other things, what's happening in mental health? So we got about £600,000 as a bridge across the winter to invest in services, which we've done in different areas. We've increased staffing where we can, but fundamentally the challenge has been finding the staff, to be honest. But we've got money and we have used in each division to that given to them. So for example, Portsmouth and South East got, I think, somewhere in the region of 150,000 maybe. That was just a sort of, that's only for 3 months to bridge through this wave of COVID. And at the same time, commissioners are reviewing their investments into mental health services in the context of COVID. So hopefully next year we'll get a better settlement and we'll be able to increase baselines. But so the short answer is, for now, there is money available if we can find the staff. And the more important medium-term answer is getting the right level of ongoing investment into mental health services that we continue to work with commissioners on all the time. There was then a question from Gillian around, I think Paul has answered, around distances within the workplace really, and 2 meters is the rule. But I suppose if you can't maintain 2 meters, which you really should, you should be wearing a mask for a short period of time anyway, Paula. Is that right?
Yeah, you should. Yeah, 2 meters with a mask.
Yeah.
Yeah.
Okay. So I'm just trying to pick questions up as they go. I was hoping Paul would prepare for this bit.
So I'm back.
Any other questions? You're back. So
yeah,
we'll take the first couple of questions.
Yeah, I completely lost sound. So have you picked up the issue? I think a couple of people have picked up the issue around second doses of the vaccine. Did you manage?
We're just going to that, so I'll leave it to you now. Yeah.
So I think Kim, and there was another question, as I've slightly lost, given that I couldn't hear and had to go back out. But the second dose of the vaccine, what's our approach? I think there was a query around whether it's 12 weeks. Somebody's got a date that was 6 weeks hence. How are we picking up the second dose of the vaccine? I don't know whether Raj is in the best place to.
Yeah, there's 2 questions there, Paul. There's one about the second dose. It's been scheduled for the 15th of Feb. I suspect that you'll probably be contacted and asked to rebook, but I'll need to pass that on to someone within the booking team just to confirm. So I'm not sure who's asked the question, but certainly if you email the group email address, they'll come back to you with a definitive answer.
I presume it's Linful in Abdab.
Okay.
So that was a question from there. Sorry, Raj.
And then the second question is, how long can you wait until you've had the second dose? I know there's a 12-week until booking the second, but is there a cutoff? The short answer is no, there isn't a cutoff. The vaccine itself, it doesn't work like an antibiotic in the sense that you need to complete the course. The second dose is actually a booster dose, and it's the exact same vaccine. So what we're essentially doing is reintroducing the same material into our immune systems and hoping that we create a stronger and longer response. So what we do have is 12 weeks, but the guidance is that that's when we'll offer the second dose. But if anyone does miss it, on the off chance because they fall through the net or something else happens, they go into hospital because they're sick and they can't have the second dose, we would then offer the second dose when it's reasonable to do so. But there isn't necessarily a cutoff.
Brilliant, thank you. And I know there was just in terms of cancellations and late cancellations, I think there is a way, isn't there? I know you'd said during the conversation earlier about, it's great if we can cancel 24 hours before that's the ideal, so that we can refill the slot. But if somebody has, an emergency crop up or something there is a generic email or something that people can use.
There is a generic email, Paul, that people can email and get that sorted if it's really last minute, and then we'll hopefully find someone on the reserve list to take that slot.
Brilliant. And Sarah's put that link in, staff vaccination at southernhealth.nhs.uk. Brilliant, lovely. Gillian, I think, wanted to ask again. She said, put in the chat box about could I re-ask my question about wearing mask and a social distance, please?
Yes. Sorry, do you mind if I just clarify? Sorry, I'll take myself off video because it's a bit rude, isn't it? Could I just clarify that you did say it's 2 meters wearing a mask in an office?
Paula?
In an office, did you say?
Yes.
Yes.
Okay, so there's never been 1.5 agreed?
No, not to my knowledge. I don't know whether you've had local discussions about that, but it's 2 meters.
And
There's a very clear evidence base, Gillian, about 2 meters being the safest place to be in terms of droplets and things coming out of people's mouths. So there's a good evidence base behind 2 meters being a really good place to be.
It was the
supporting your
only...
implementation of that, Gillian.
Sorry, Grant.
I was just going to say, Gillian, support your implementation of that. The workplace risk assessment's clear around the 2 meter thing.
Thank you very much. Thank you.
Thanks.
Love your balloons, Gillian.
I'm in my grandchildren's bedroom. And it's a lovely place to be because I can break away and play a few toys if I want to. Thank you.
Thanks, Gillian. Have we got any more questions? Lots of shy people on the call today. Any more questions?
My sense is a lot of them have been answered in the chat box, like the question around the allergies and the question around contacting the vaccination hub and stuff. So it feels a lot of people have been answering them. But
yeah, I think so.
People can shout out if there's anything as well. We're open to a bit of chaos.
Encourage it, in fact, Grant, don't we? Encourage a bit of chaos. Good for us.
Yes, hi, sorry everyone. Yes, it's Jeremy from the East Community Mental Health team. Just going back to my initial question about staff burnout and high staff turnover. I mean, you can feel the impact as a frontline care coordinator from the high sickness rates and the high caseloads. What seems to me is that we seem to be replacing staff who are leaving, but we're not adding to the actual workforce, even temporarily. I'm aware that there's an NHS long-term plan going forward, but what's being done now, as in this very moment, to address the issues of high staff burnout and high staff turnover? Why aren't we getting the additional staff to cope with inevitably the auxiliary pandemic of COVID-19, which is mental health?
Yeah, and I think yeah, there's no doubt that it's a significant challenge for people, and I don't say that in any sort of trite way. I do know from talking to frontline staff regularly, and I also am aware of the things that a range of areas are trying to do to spend the money we've given them, and they're struggling to spend it, is the absolute truth. So we've doubled up people in some of our crisis teams. We've invested in some doctors coming in over the weekend to support wards and support the crisis teams. We've done a range of things. But I think the reality is finding people who want to move at this time. I think very few people want to move roles. So a lot of our thing is, I'm afraid it is a bit of sticking plaster at the moment, Jeremy. It's that sort of, I think that's where we are. We are doing what we can to get the money. I don't think money's a problem at the moment. I think it really is finding the right skilled and qualified staff, and as you say, retaining them. And most important part of retaining is the second part of your question, which is how do we support resilience? And I think there's many ways to do that, but I think the evidence base is pretty clear the best way to do it is supporting people within their teams to have meaningful jobs that are of the right size. And often a lot of people at the moment's jobs are stretched and they're doing more than they would usually do and have done for some time for a range of reasons. Before COVID, but during COVID, it's been worse. We don't have a clever answer. We have a lot of work going on to secure funding for staffing. To be honest with you, if we could find 20 more care coordinators today, we'd employ them. I've got no doubt about that. We have the money to do that. We have relatively low vacancy rates in our community mental health teams. However, compared to our wards, which are a real struggle, however, we do struggle when people are off sick, as you say, and that's to do with burnout. So it's a bit of a vicious circle, I think, is what you're pointing to. And we're doing what we can to stop that sort of downward spiral. And I'm sorry if that sounds a bit sort of management speak. It's not meant to. We're struggling with your senior leads to make sure we can resource your services. And I think we are. And I think what's showing me trying to spend £600,000 the last month is it's been really hard to find anybody to come into those roles. And I guess that's what you're reflecting.
Yes, agreed. Yeah. Agreed to some extent. I mean, really appreciate your answer, on that perspective. I mean, I can understand if you are prioritizing the acute services, such as acute mental health services. But when you look at the community perspective, which is where I'm situated, at any one point, our cases, what we're seeing is that people are coming in a lot more often with a lot of depression and anxiety, but they're waiting a longer time before they contact their GP. And when they do contact their GP, they need a bit more intense intervention than what would be the usual circumstances. Also from a community perspective, there seems to be more of a delicate balance as to when any person on your caseload can become acutely unwell at any time. And that can be several people at once becoming acutely unwell. So in terms of the increasing demand,
sorry to interrupt, but I'm just aware that we're getting towards the time, and just if there's any other questions, Jeremy, I'm happy to, Skype me or email me, and I'm happy to have a chat offline. I've got plenty of time at the moment.
Yeah, sure.
Which sounds a bit bland, but the nature of my job is I'm here to help at the moment. I've cleared my diary, so I'm more than happy to have a chat. But in terms of community mental health teams generally, we have got investment coming next year into primary care mental health, which will sit in community mental health teams, but will hopefully be able to reduce the impact of people who maybe more traditionally were at the less, say, acute end of the spectrum, and you would have more staff to do that. And that money is coming into each of our areas next year as part of the National Service Framework implementation, or the National Framework for Community Mental Health Teams. So happy to have an offline discussion, but just want to leave a wee bit of time for anyone else.
Grant, thanks, Jeremy. That's really, really helpful, and absolutely understand. I think we all understand the challenges that we've got at the moment. So thank you.
Thank you
for raising that. A couple of quick questions. Nicola has put in about redeployment, and Louise has come back with a site with an email address, but I think Nicola's still having problems. She's not heard anything back. Louise, do you want to pick that up with the team and make sure that we get a response over to Nicola?
I will do, yeah, no problem.
Thank you. And then Lucy has put in, do staff need to complete another consent form when attending for their second dose? And if so, when will this be made available? I think Jenny put in this, her second consent form is available on the intranet. So there is an intranet page, and I would imagine will also be available in the hub, Raj, for people for second doses.
Yeah, sorry. So the main thing that we need to consider when we have the second dose is if we've had any adverse reactions to the first dose, and make sure that the individual's medical history hasn't changed since the first dose. Clearly, if there's a new illness that we need to consider before vaccinating, that's something that we need to be aware of so that you're kept safe. And secondly, if you've had a severe reaction to the first vaccine dose, then clearly that would be a reason not to give you the second dose. We expect some common sort of side effects, which typically is sort of a headache or a sore arm at the injection site. But apart from that, you know, we were not expecting anything more severe.
Brilliant, thanks, Raj, and hopefully, Lucy, that's picked up your next question as well in terms of the difference between consent. Then I saw Sharon did put on, can comms please put all the questions raised on this chat today and the answers out for everyone to read afterwards. And Jenny's put that we will have a video for all staff, but presumably we can also do this in a sort of Q&A type thing, so people don't have to watch the whole video and can just scan the questions as well. I'm looking for someone from the comms team to...
Yeah, Paul, what we've been doing is trying to put some of the key questions from these chats onto our FAQ page as well.
Brilliant.
So that's really the best central place to go, is that FAQ page on the intranet, and that's where all the most up-to-date questions and answers are that we've been getting. So I'd advise people to go there and keep checking there, and we'll pull questions from there into the daily bulletins as well. So the sort of hot topics.
Lovely. Thanks very much.
Okay.
And thanks, Lucy and Sharon, for those questions. Back to you, Grant.
Okay, I think we probably unfortunately need to draw it to a close. It's always the way we probably end up talking about at the end of meetings, the big and middle. Look, thank you for joining us. Of course, take care of yourself. Of course, stay at least 2 meters apart. Of course, wear your face mask and wash your hands. But I think one thing that as a senior leadership team we want to get across today in particular, and I think it goes back to one of the points Sarah made in the chat, which is look around you and see colleagues that maybe aren't as in strong a position as you, either in life or work, and able to get off for the vaccinations and help them get off. That might be more junior staff, it might be staff with certain life circumstances that makes their management and juggling of family hard. Just a really serious thing. Ask your colleague, have you got for your job yet? And if the answer is, oh, but my husband or my partner or my, you know, and I don't, try and find a way of helping them get off, particularly off wards, for people that don't have diaries that can't stop and get for their jobs. It's crucial we get those people vaccinated, because they're the people that often lose out in these sorts of programs. So we want to leave that message with you. Look around your team and make sure that the most junior people, or whether that's our domestic staff, or whether it's potentially some of the newer workers in the team, whether it's healthcare assistants, whatever, anyone, just ask the question of each other to encourage each other to get vaccinated and get protected. So thank you very much for your time again, folks.
Thanks, everyone.
Bye. Bye, everyone. All the best.